Steve Olson, I'm one of the orthopedic surgeons here at Duke University. I can't remember a time when I didn't want to be a doctor. Part of that was probably my mom. My mom wanted to be a doctor. My dad ran a gas station, a service station, so I grew up being a mechanic and, sort of the orthopod. We use a lot of tools and saws and this and that, so that from a skill set that just felt right to me. I started my career in sort of trauma and fractures and broken things, and over the years it's evolved really to a focus in hip and pelvis and hip and pelvis reconstruction. Very early in my training, there was a patient that came in with a really bad, wicked pelvis fracture, and it was at that time when the whole science of how do you treat pelvis fractures was a little bit unknown, and so it was kind of a black box, and that really intrigued me. And so I spent a lot of my early years understanding how do you take care of trauma and how do you fix broken pelvises and how do you put things back together. And so that gave me a really in-depth understanding of the hip and the pelvis that still, is very valuable to me today. Well, I have lots of favorite parts of my job. From a patient care point of view, it's really enjoyable seeing the patients doing much better. When they come with this really problem and they're just unhappy and their hips hurt and they're able to walk out, substantially better. That's really enjoyable. I like to do surgery. I do surgery, but a lot of times you don't need to do surgery to get a patient better. So it's about understanding that when does non-operative care work and when does it not work, and when do you need to move on to other things, and try to help the patient understand that.